Health experts are urging high-risk Australians who are eligible for another COVID booster shot to get a fifth dose. The latest advice suggests people who haven't tested positive or had a COVID-19 vaccine in the last 6 months should get another dose. Data shows millions of people are yet to get their third and fourth shots, including some in high-risk groups. Professor Julie Leask from the School of Nursing at the University of Sydney says people with risk factors are more vulnerable.
Many people have had a relatively mild illness, but it is still severe for some Australians. So in our last wave since October, there have been 2,600 deaths from COVID, and 800 of those deaths have been in aged care residents. So it is still a serious disease for some people, and that's why this additional booster dose is recommended for people who are at risk of serious disease, and it will approximately halve their risk of hospitalisation compared with if they hadn't had an infection or booster from 6 months previous. Looking here at the 18 to 64-year-olds who are healthy, they can have a booster if they would like to, but their risk of getting severe COVID, that means going to hospital or even dying from COVID, is vastly reduced by virtue of their age and health. So this is a nuanced recommendation. If you're older, look at whether you're due for your booster 6 months out from your last infection or your last vaccine, and if you have any risk factors and you're younger, over 18, then also look at that as well. So you're allowed to get a booster from the 20th of this month onwards, and any booster is better than no booster at all if you're in that boosting recommendation category. There is a bivalent vaccine now available. In other words, it's going to give you some protection against both the original variants and the Omicron variant, and that will give you a bit of additional protection. So the recommendation is to have that, but if that doesn't happen to be available for you, go ahead and have a booster anyway, because one booster, regardless of whether it's monovalent or bivalent, is better than no booster.